Assalamu alaikum. This is Dr. Mrs. Saeed and welcome to our channel Dr. Mrs. Saeed. Alhamdulillah, this is my clinic and I do OPD every day, gynae and ops, and I do Sharai Parda, Alhamdulillah. So that's why I wear this. So today's our topic is about polycystic ovarian syndrome, PCOS. This is most common in women. So what is polycystic ovaries? In polycystic ovaries, your ovaries become enlarged and contain many fluid-filled sacs like follicles that surround the eggs. Polycystic ovaries contain a large number of harmless follicles that up to 8 mm and approximately 0.3 inches in size. In polycystic ovarian syndrome, these follicles are often unable to release an egg, which means ovulation doesn't take place. Polycystic ovarian syndrome is a common endocrine disorder of unknown etiology affecting 5 to 10% of reproductive age women. Polycystic ovarian syndrome is characterized by chronic anovulation, polycystic ovaries, and hyperandrogenism. It is associated with hirsutism and obesity, as well as an increased risk of diabetic mellitus, cardiovascular diseases, and metabolic syndrome. Unrecognized or untreated PCOS means polycystic ovary syndrome is a risk factor for cardiovascular diseases. जी हाँ, पॉलीसिस्टिक ओवरियन सिंड्रोम को इसी तरह अनट्रीट छोड़ देना, उसका इलाज ना करवाना बहुत बड़ा रिस्क फैक्टर है दिल की बीमारी के लिए. Now we talk about signs and symptoms, clinical findings. So polycystic ovarian syndrome often presents such as menstrual disorders ranging from amenorrhea to menorrhagia. Amenorrhea means no menstrual periods and menorrhagia means heavy bleeding, heavy menstrual periods. And infertility. Skin disorders due to peripheral androgen axis, including hirsutism and acne, are common. Patients may also show signs of insulin resistance and hyperinsulinemia, and these women are at increased risk of early onset type 2 diabetes and metabolic syndrome. Patients who do become pregnant are at increased risk of perinatal complications such as gestational diabetes and preeclampsia, eclampsia. In addition, they have an increased long-term risk of endometrial cancer secondary to unopposed estrogen secretion. Now we talk about treatment. In obesity patients with polycystic ovarian syndrome, weight reduction and exercise are often effective in reversing the metabolic effects and in including ovulation. And walk is the best exercise. For those women who don't respond to weight loss and exercise, so they have to take metformin therapy. Metformin is a generic name and it's come in the trade name of glucophage, may be helpful. Metformin is beneficial for metabolic or glucose abnormalities and it can improve menstrual function. Metformin has little or no benefit in the treatment of hirsutism, acne or infertility. It's just we can use in polycystic ovarian syndrome. Now contraceptive counseling. Contraceptive counseling should be offered to prevent unplanned pregnancy in case of a return of ovulatory cycle. For women who are seeking pregnancy and remain anovulatory, clomiphene and other medications can be used for ovarian stimulation. Clomiphene is the first-line therapy for infertility. Next topic we will talk about infertility, but here is a topic, polycystic ovaries. So, if induction of ovulation fails to treatment with gonadotropins, but at a low dose and a lower risk of ovarian hyperstimulation syndrome, may be successful second-line therapies such as use of aromatase inhibitors or laparoscopic like ovarian drill are on unproved beneficial. Women with polycystic ovarian syndrome are at greater risk than normal women for twins gestation with ovarian stimulation. If you don't want pregnancy, if the patient doesn't desire pregnancy and doesn't want or is not a candidate for contraception means if she is unmarried, so what should she do? So they progesterone accelerate saccade 10 mg per day orally for first 10 days she can take of every 1 to 3 months should be given to ensure regular shedding of the endometrial and thus avoid endometrial hyperplasia. It's saccades, it's just supportive treatment, not specific treatment. When we talk about specific treatment, so we should give metformin like glucophage and contraceptive medication like hormonal medications such as you can give Familiar 28 or Pramlute N or others like Dine 35, and there is a lot of trade name medications in the markets you can take. But avoid self-medication. Don't take it yourself. Just go to the doctor, go to your doctor, routine checkup, and she or he will prescribe you the medications. Now we talk about foods. Women suffering polycystic ovarian syndrome should avoid the following foods. Number 1, sugar drinks. Sugars is very dangerous for polycystic ovarian syndrome people because it leads to weight gain. Fried food. Number 3, processed meats like sausage, hamburger and hot dog. Refined carbohydrates like white bread, pasta and pastries. Processed food like cake, candy, ice cream and excess sugar. Just avoid sugar. Sugar is very dangerous for PCOS patients. So now we end our topic. So before the ending we have to talk that please don't forget to subscribe our channel and click the black icon and like this video and share this video. If you have any inquiries, if you have any question, so you can ask in the comments box. Thank you. Bye bye. Allah Hafiz. Jazakallah.